the next week or two are going to be the most stressful, and I know that Dr. Fuller had mentioned it, but it's not just, January and February are always busy for hospitals, and it's no different now. But one of the things that's going on is that our staff, even though vaccinated, are getting minor COVID infections, and that keeps them from coming to work for 5 days because you got to isolate just like everybody else. And so that's a little bit what's making it different. I think once we get past this sort of holiday bump here and the next week or two, that things will get better. The prairie fire of Omicron, though, will leave the urban areas and move out a little bit more to our rural areas. And so some of the smaller hospitals that aren't necessarily in the big cities might be seen more, at least the ones that are non-health system affiliated. But I think this is mostly going to be a January phenomenon. And once we get into February, things will start getting better. And certainly once we start having fewer healthcare workers getting infected and having to sit out waiting for their 5 days, it'll definitely get better. So, really what we know now, but what we didn't know when we rolled out the vaccine campaign, is that the messenger RNA vaccines, Moderna and Pfizer, really should have been a third shot series all the time. And so where for other 3-shot series vaccines, we just schedule that last shot out at 6 months. For this one, we kind of had to learn as we went. And so when you hear the word booster, think third shot as part of your series. And I actually think the ACIP at the CDC is going to be reevaluating that and changing the way we think about that in the near future. Well, will there be boosters for us in the future? Well, the question is going to be, is it going to be like the flu shot, where we need a modified booster every year? Or will it be that the initial 3-shot series will be enough? And what that depends on is something we don't know yet. And what that depends on is, will Omicron and the immunity provided by vaccine and Omicron itself be enough to reduce the severity of COVID and to reduce the meaningfulness of COVID? And so that if, it really morphs more into a cold and minor infections, except for immunocompromised people, then we treat the immunocompromised people with drugs that we either have now or down the pike, and we don't necessarily worry about boosting the population all the time. So the short answer to your question is that if you've had 3 shots of a messenger RNA vaccine, for right now, you're done, and that's all you need. Running out and getting more boosters is probably not going to be worth your time or energy. It's probably not going to help you that much. And whether or not we'll have to have them in the future, we'll see. But, it was said the other day in the national media, you can only boost the world so many times. And so at some point, we're going to have to just have to live with the boosting that we have.